So this morning I woke up with some sacroiliac irritation from deadlifting yesterday and also doing some glute bridges. So the reason I knew it was sacroiliac and not lumbar was just due to the location. So instead of it being lower back, it was more like down here. Like if here's my tailbone, my sacrum, it was kind of on both sides. So it wasn't really a matter of it was one side or the other. Typically what I found with my patients is one of the pelvic bones rotates, and the other one typically rotates the counter direction just a little bit. So usually I find out which one's the most irritated and we fix that one. For me, they're kind of both sore and achy, but because we're hitting it soon, it was just the morning after. It's not killing me, but the more I'm in one position, the more I sit. If I sit too long, it gets irritated. If I stand too long, it gets irritated. And is normally just relieved by trying to move around, walk around, something like that. So I'm going to show you how I went ahead and fixed it, and actually didn't even really care so much which way it was rotated because, like I said, both of sides didn't feel very good. So I went ahead and just did sort of a shotgun approach that you can do sometimes when it's just a small bit of a rotation. So here's how I do that. So I'm going to lay here with both feet up. I'm going to put my hands on my knees. I'm going to alternate pushing in to my hands. I'm going to do about 5 each side, so this is just an isometric contraction. If there was one of the pelvic bones was rotated backwards, that would rotate it forwards. And just to make sure I keep everything balanced, I'm going to do the same thing on the backs of my legs, or I could just grab the front of my knees. But on this one, I'm going to try to push down. I'm going to resist. So I'm going to try to push. So just a couple second holds. So we refer to those as muscle energy techniques, which just means that we're using our muscles to provide a little bit of force. If it's an isometric contraction, we can use that muscle to kind of torque that joint back to where it should be. So that's what I did today to help with the sacroiliac irritation I was having on both sides. And it pretty much went away right away. What I normally do to retest that is just do a standing backward bend, because that's normally what feels the most irritating. So today, this morning, this really didn't feel good. And after I did that technique, it wasn't too bad. And as the day has gone on, it's gotten quite a bit better. So those things just sometimes happen after some back days. Yesterday was deadlifting and glute bridges and some unilateral work too on each glute, which probably was a little bit stressful. So especially as females, our pelvises are shaped differently to also allow for a little bit more movement. So that's how I go about fixing my own sacroiliac issue if I don't know which way I'm rotated, or if it's just a little bit of rotation, just trying to help balance things out. All right.